Hello, and welcome to this presentation on androgen-producing ovarian tumours. My name is Elizabeth, and I'm a student in the University of South Wales studying endocrinology. And today I will be covering the key aspects of these rare but important ovarian tumours. Let's get started. Androgen-producing ovarian tumours are a rare type of ovarian neoplasm that produce excessive amounts of male hormones. These tumours can lead to virilization, symptoms such as excessive hair growth, deepening of the voice, and menstrual irregularities. Early detection is crucial as these tumours can significantly impact a patient's quality of life and reproductive health. There are four main types of androgen-producing ovarian tumours. First one, Sertoli-Leydig cell tumours. These are the most common, usually found in young women and often present with mild to moderate virilization. Granulosa theca cell tumours. These typically produce estrogens, but in rare cases may secrete androgens. Hillious cell tumours, derived from ovarian hillious cells. These are rare but highly androgenic. And 4. Steroid cell tumours, a group of tumours with no specific classification but often linked to severe androgen excess. Understanding these tumour types is key to accurate diagnosis and treatment. Androgen-producing ovarian tumours often lead to symptoms caused by excess male hormone production. These include excessive hair growth in a male patron, deepening of the voice, enlarged clitoris, acne and oily skin, male patron baldness, menstrual irregularities such as frequent or absent periods, infertility in some cases. Additionally, some patients may present with abdominal pain or even a detectable pelvic mass. If a woman develops sudden virilization, an androgen-producing tumour should always be considered. The diagnosis of androgen-producing ovarian tumours involves key steps. Clinical examination. A doctor will assess symptoms of virilization and may perform a pelvic examination to detect mass. Hormonal tests. These typically show high testosterone levels, often exceeding 2 nanograms per milliliter, while DHEAS remains low or normal, helping to rule out adrenal causes. Imaging studies. A pelvic ultrasound is the first-line imaging test, but an MRI or CT scan may be needed for further evaluation. Histopathology. The definitive diagnosis is made through biopsy or after surgical removal of the tumour. A combination of these tests helps distinguish these tumours from other conditions with similar symptoms. Excuse me. When evaluating a patient with excess androgens, it's important to consider other possible causes. Polycystic ovary syndrome. This is the most common cause of excessive hair growth, but unlike tumours, it presents with bilateral ovarian enlargement and metabolic issues. Adrenal tumours. These can also produce excess androgens, but they typically show elevated DHEAS levels. Cushing's syndrome. Features include central obesity, facial rounding, and high blood pressure, alongside androgen excess. Exogenous androgen use. This includes anabolic steroids or supplements which can mimic the effects of an androgen secreting tumour. Proper diagnostic workup ensures accurate differentiation between these conditions. The mainstay of treatment for androgen-producing ovarian tumours is surgery. Removal of the affected ovary is the primary treatment. In fertility-preserving cases, conservative surgery may be considered if the tumour is benign. If malignancy is suspected, staging surgery may be necessary. For medical management, anti-androgens like spironolactone can help control symptoms. Oral contraceptives may also be used to regulate hormones. Follow-up is essential with regular hormone monitoring and imaging to check for recurrence, particularly in malignant cases. The prognosis of these tumours depends on their nature. Benign tumours, like many Sertoli Leydig cell tumours, have an excellent prognosis after surgical removal. Malignant variants require close follow-up and in some cases chemotherapy. Post-treatment hormonal normalization occurs gradually, with most symptoms resolving over time, though some changes like deepening of the voice or hair loss may be permanent. With early detection and proper treatment, most patients have good outcomes. To summarise, androgen-producing ovarian tumours are a rare but significant cause of virilization. Early diagnosis is crucial, especially for fertility preservation and symptom control. A structured approach, including hormonal tests and imaging, helps to differentiate these tumours from other conditions. Surgery is the primary treatment with excellent outcomes for most benign cases. Recognizing these tumours early can lead to effective treatment and better patient quality of life. This presentation was based on established medical literature and guidelines. Thank you for watching, and I hope this session has been informative. If you have any questions, feel free to leave them in the comments.